Periods! But not just your average everyday period, endometriosis periods. Periods suck on their own. They cause cramps and headaches and bloating and body aches, backaches, breast tenderness, mood swings, all these hormonal ups and downs. If you have a pretty bearable period, good for you. Endometriosis is a little different. A lot of women that have endometriosis have it for years. The average seems to be 10 years before they're even diagnosed or before they even hear the word. And that's exactly what happened to me. So before I explain what endometriosis is, I'm going to describe what happens during a regular period, because endometriosis seems to be the most agitating or reach its peak during menstruation, and obviously women that are already menstruating or are at reproductive age are the ones that are most prone to endometriosis. So I drew a little uterus for you. The fallopian tubes are very, very exaggerated. This is not drawn to scale. An actual uterus is only about small enough to fit in your hand, and the fallopian tubes are much smaller, but this is just for a visual aid, so not drawn to scale. So inside the uterus, we have this endometrial or endometrium lining, and this tissue, when your body thinks you're going to have a baby, this is the tissue that turns into like a little blood nest for your zygote or your fetus or whatever. It's like, I'm going to prepare for the baby. So what happens is all this stuff kind of on the lining, fills up with blood and becomes a nice little like cushy, cozy sack for the baby. And then your body's like, excuse me, I'm not pregnant, and your body gets mad at you and punishes you with a period. No, I'm kidding. It's not, well, it feels like that. All this blood, this lining that built up that wasn't used because you didn't have a baby, just escapes. Goes out the vaginal canal, comes out, and, you're bleeding for about a week, and you have some discomfort because the uterus contracts a little bit during your period to get the blood out, and it also inflames. It does get a little bit inflamed because there's a lot going on down there, and then you have your period and it's over. Fine. However, women with endometriosis, this same tissue that should be inside the uterus, for some reason there's some switch in the body or they don't know if it's genetic, they don't know if it's hormonal, this same tissue is somehow growing on the outside of the uterus. So you start to get weird blood tissue on the outside of the uterus. You can get them on your fallopian tubes. You can get them on your ovaries. There are some women that get it like all the way up here on their intestines, or even up. Some women, poor things, you have it attached to your lungs. Time out. I'm editing this right now, and I just wanted to apologize because I'm realizing in the beginning of the video I'm using a lot of cis-normative language. I'm not always conscious of this, so I do let the word woman slip out a lot. So I want to apologize to non-binary people, men that might have a uterus, trans people, genderqueer people. A uterus does not a woman make, so I just want to apologize. I'm not trying to alienate anybody. I'm not trying to dismiss anybody's pain or invalidate anybody's gender. I think right about here I become a little bit more conscious of this, and I just keep using the anatomical term uterus instead of using gendered words like woman or female. So again, I apologize. Hopefully from here on out I don't let it slip as much anymore, and I hope that you can still kind of enjoy the rest of the video as much as you could enjoy a video about menstruation. This is a problem because there is no exit for this blood, for this tissue. It's not attached to the vagina, so it can't go out during a period. With every period that you keep getting after this, there's just more and more blood. So it keeps building up and caking up and spreading everywhere, and eventually, or at least in my case, I had something called a chocolate cyst. I had many chocolate cysts, and they were huge and disgusting, and that's because this blood turns brown and congealed, and it's all like caked up, and when you cut into it, it actually looks like chocolate fudge. It looks like mud or poop. It's gross because it's just years and years and years of blood building up. So even if you have a normal, healthy period, it is normal for uterus to swell and get red and inflamed and irritated because a lot of stuff is happening. So, a normal, healthy period, the uterus might actually, get bigger, like around where this black line is. The uterus does swell. A uterus that has endometriosis might become even bigger than that, like super swollen. Not everyone that has endometriosis experiences super painful periods, but that is like one of the number one symptoms, and that's what makes it the most debilitating because it's not a normal period cramp. I eventually diagnosed myself because I had so much inflammation, probably mostly from the uterus and from the cysts, all the way, not actual cysts up here, but inflammation and swelling up in my diaphragm. And there's a nerve that is attached to your diaphragm that goes all the way up into your shoulder. That's why gas pain can sometimes be shoulder pain. It's because of something happening in here triggering this nerve that goes up here. And when my periods were at their worst, I was having trouble breathing. I couldn't take a deep breath, and it hurt. In fact, there was so much inflammation, I was walking hunched over. It hurt to stand up straight because it felt like I was stretching something in here. I was also throwing up a lot. And it can also be really, really hard to go to the bathroom. Because if you look inside this cul-de-sac here, the uterus and the colon are right next to each other. They're buddies. They're like practically hugging and holding hands. If you look in a textbook, it looks like everything is all nice and spaced out and everything has room. Nuh-uh. Your organs are literally just all squished together. It's like when you keep cramming clothes into a sock drawer and you don't even bother like taking things out to fold them. They're just all like hanging out. So the uterus is right next to the colon, and it's also right next to your bladder. So if you have all this swelling pushing, almost like closing off your bladder and closing off and like pinching and squeezing your colon, it's hard to go to the bathroom. So I had my surgery in 2012, but I had this pain for almost 10 years. I started menstruating when I was 13, so that's 2003. Maybe my first year of menstruating was normal. My cycles were still kind of erratic. My body was still figuring out what was going on. But I want to say, like, once I turned 14, they just became painful. I was crying in school. I would have my head down. I would pass out in class. The nurses wouldn't give any painkillers, and I kept going to gynecologists, and they kept saying, "Oh, you're fine. You're fine. Here, just take some drugs. We'll put you on the pill. Just take some painkillers. Here, we'll put you on the birth control pill." First of all, I knew I was not fine. I knew this was not a normal period, and I have a super high pain tolerance, so if somebody like me is crying over period pain, it's not normal. I'm not fine. I also refused to go on the birth control pill because I didn't want something that was just going to mask the symptoms. The birth control pill is not a cure, it's just a temporary band-aid. So why does it take so long for endometriosis to be diagnosed? Mostly because doctors are assholes and they think they know everything. They think they know your body better than you do. We get accused of being dramatic. We're faking it. We just want attention. I had to diagnose myself. I had to call a completely new office that I had never even been to before, to see a fresh doctor that wasn't tired of me complaining about this problem. And I said, I have endometriosis. I need to come in. So I actually went in while I was menstruating. This was like the middle or end of my period. I was done throwing up, and my chocolate cysts were so big that the doctor could actually see them and measure them on the internal sonogram or the ultrasound. Most people say you can't get a definitive endometriosis diagnosis unless they actually do exploratory surgery. Well, not in my case. My cysts were so damn big that they were visible on the screen, and this doctor was livid. He was like, this is not something that popped up overnight. These have been here for years. How did doctors miss this? I said, I don't know. I've been telling them for 8 years or something that I'm having all this pain. They just keep trying to give me drugs. Some doctors might also try to push you into taking Lupron, which is essentially like a chemotherapy drug, and it induces menopause. So yeah, you won't have endometriosis pain because you won't be menstruating. You won't be making any hormones. You literally go through menopause. You have hot flashes, cold sweats, insomnia, no energy, no sex drive, because your body is not producing estrogen, and estrogen is something that fortifies your bones. You are much more prone to bone fractures and muscle weakness. I did eventually go on Lupron, but it was after my surgery, and I'll go into why I did that afterwards. So what to expect when you go in for surgery. The surgery is usually laparoscopic, which means they go through your belly button and they make a couple of other tiny little holes. They do belly button, and they do here, and they do like one side or the other, like right around here. But they're so tiny you don't even see them after they heal, so you don't really have to worry about any scarring afterwards. They essentially burn out the cysts and they burn out the unhealthy tissue. In extreme cases, if the uterus is just super deformed and there's just nothing normal about it, they might do a partial hysterectomy, which means they take out the uterus but they leave in the ovaries so that you don't go straight into menopause. Recovery sucks. Honestly, the pain down here is not as bad as the pain up here. Remember how I said that once your diaphragm is irritated, you get shoulder pain? When I was recovering from the surgery, I just had bad shoulder pain, and it took maybe 3 or 4 days to actually dissipate. That's because when they do the surgery, they fill up your belly with gas, so there's room for them to move the instruments around. And even though they do deflate you, this diaphragm nerve, this nerve is still irritated. You know, even though all the gas is out, it's still firing all these signals. So honestly, the shoulder pain was the worst of it. This did hurt though, and moving and contracting the stomach muscles was pretty hard. So if I was laying down, there was no way I could just sit up like this. I had to use my arms. So I would put my elbows under me and I would push up with my elbows, and then I'd get my hands and I'd push up with my hands. So once you can figure that out as far as sitting up, you're okay. I was walking on the first day. I mean, not very well. I was also eating on the first day. I'm pretty lucky. I've never had a bad reaction from anesthesia. Because I have super, super low blood pressure, it is kind of an issue every time they try to sit me up after surgery. Like, they'll sit me up and I'll pass out. But it did take them a while to get my blood pressure back up. I think they gave me like a cup of coffee and then I finally perked up. I'm an athlete, so I was in pretty good physical shape even before the surgery. But if you're mostly sedentary, or if you're not super athletic, and if you don't have a lot of like muscle mass already, something that they have you do is like press a pillow against your belly, and as the pain goes away, they want you to like practice coughing and like contracting so that your muscles don't atrophy, because you know you're not using them. But I'm a ballet dancer, and I think by day 4, I was doing just regular leg exercises, you know, just doing pliés and relevés, basically calf exercises, so just, you know, going on my toes. And I think it took about 12 days or 14 days before I was back in ballet class, like at least taking the bar. The only things I really had trouble with was contracting and stretching. So like any kind of contraction that I needed to do here to lift a leg up was painful. I couldn't really do that. My legs had to stay pretty low. And any kind of back bend where this stretched, I actually felt tightness right in the belly button. So I couldn't like bend back all the way like I usually do. So that's the physical recovery. So like I said, the doctor did put me on Lupron after the surgery, and his reasoning was that he wanted my anatomy to have a rest period, like a break. So after the surgery, he did not want those organs to be irritated by periods. He wanted to cease menstruation, stop all the periods so that everything had a chance to rest and recover and kind of go back to normal and uncrumple, because he said my fallopian tubes and my ovaries were all kind of like squished up like little crumpled deflated balloons. And he acknowledged that Lupron was not a preventative medicine. It should not be used to treat or cure endometriosis because all it does is stop your periods. Once you go off of Lupron and get your periods again, you're going to have endometriosis. It's still there. So Lupron was miserable. I actually went through menopause. I was on it for about 6 months. It's really not recommended to be on Lupron for any longer than like 6 months at a time. There are all these message boards and chat groups and stuff of women that have had like serious, like long-term side effects from it. You know, they have like brittle bones now or even brain lesions. They come up with all these autoimmune disorders. Here are a few reasons why I think I bounced back from Lupron so quickly and did not have any of those side effects. Number one, I did a lot of research about hormones. So remember how I said that estrogen is what fortifies your bones and your muscles and makes you strong? That's why older postmenopausal women are more prone to bone fractures. So I had to brush up on all the things that keep your bones and muscles strong. I'm already an athlete, I'm a ballet dancer, so my bones and my muscles are in pretty good shape. So I had to protect that. So I took copious amounts of calcium, I took copious amounts of vitamin D, I took a lot of magnesium, and in the beginning, I was taking a lot of fish oil because omega-3 fatty acids help keep your joints all like lubricated. But it wasn't fish oil for very long because halfway through my Lupron treatment, I went vegan. That means I cut out all meat and dairy, no more eggs, no more fish. And those things alone, meat and dairy, cause inflammation. Our bodies really don't like meat and dairy. We're really not meant to be eating either of those things. So the fact that I had this really great, healthy, plant-based diet and I was getting all these, like, nutrient-dense foods, vitamins, and minerals, I think that also helped not only keep my bones and my muscles strong and keep all my organs healthy, I think it also helped my body detox from the Lupron drug when I was done with it. I've read stories of people that were on Lupron and they stopped, but their bodies didn't go back to normal until like a year later. I was on it for 6 months. I stopped on the 6th month. I got my period the next month. Everything was back to normal within a month. My first period after the surgery, so again, this was 6 months after the surgery because I was put on Lupron for 6 months. My first period after the surgery was very painful. I was crying. I was also very overwhelmed because I'm sure there was all sorts of like crazy hormonal things happening. You know, my body had just gone from making no hormones to, I guess, essentially going through puberty again. My first period after the surgery was day 1 of American Ballet Theater's summer intensive, which is my life. I always get my periods on like really important days or performances or auditions or interviews or vacations. That's just my life. And after that, I was put on one birth control pill that made me crazy, and then I got a different birth control pill that also made me crazy. Birth control pills essentially just make me depressed and I can't be on them. So endometriosis can come back. Most of the time it does come back, even if you have the surgery. My periods are painful. Again, I had the surgery 5 years ago, and while my periods are not as bad as they were in like the months leading up to the surgery, I cannot do anything on days 1 and 2 of my period. All I can do is take painkillers and lay down. And this is not the kind of pain that Tylenol or Motrin helps. No, I need like Percocets. So I am seriously considering, I'm not even considering anymore, I essentially decided, it's just a matter of time, that I want to get a hysterectomy. And I should note, hysterectomies don't even guarantee relief anyway. A lot of the time it does, but sometimes the uterus is not the problem area. That tissue, for whatever reason, can grow in other parts of the body, so a hysterectomy might not help them. But for me personally, my endometriosis and my chocolate cyst seem to be very uterus-centric. Like, it all seemed to be right around the uterus and the fallopian tubes. It didn't really spread to other parts of my body. So I want the uterus out. And even if a hysterectomy does not give me relief from endometriosis, I still have a lot of other reasons why a hysterectomy would be practical for me. Like I said, I always get my periods on very important days. I don't know why. my period is a week late or a week early, just so it can land on like a ballet audition that's very important to me, or so it lands on the first day of a performance and I can hardly perform, or when I'm on vacation. I'm convinced my body just hates me and my uterus is out to sabotage me. I also don't want kids. I'm the last person anybody should wish kids upon. I would be a shitty mother. I'm a good cat mom, but that's about it. So because I don't want kids, I don't want to get pregnant. So even though getting a hysterectomy as a form of birth control is pretty extreme, I don't care. Because I can't be on a birth control pill. It makes me suicidal. Condoms suck. Let's face it. Who likes to have sex with condoms? I don't. I hate it. As it is, I have so many adhesions and so much scar tissue in there that to use a condom feels like a combination of when you skid your knee on those gymnasium floors that are all varnished, along with your sock coming off your foot inside of your shoe. Even if one day I feel that maternal urge and I want to have a little offspring, my sister offered to be my surrogate. How fucking awesome is that? So that's my story. Periods suck. Endometriosis sucks. If you have endometriosis, or if somebody you know says they have endometriosis, believe them. We're not faking it. We're not acting sick for attention. If anything, most of the time we're acting well. So all you uterus-bearing people that have endometriosis or think you have endometriosis, stand up for yourself. You know your body better than your doctors do. And I'm really sorry if you've had doctors invalidate your pain or dismiss you. Hang in there, find another doctor, get a second opinion, get a third opinion, do your research. Stay strong.